Good afternoon and welcome to this real-world project management webinar, Overcoming Challenges in an Undervalued Sector in the Professional World. Today we're joined by Ala Katab. Ala is an experienced consultant, project manager and civil engineer and an international development practitioner. He is also a full member of APM with 15 years plus experience in working in construction and engineering in the private and disaster relief sectors. Ala has first-hand experience in humanitarian assistance with expertise in leading water, shelter and health infrastructure projects and programs with international and local NGOs such as Oxfam, Madare during the Syrian crisis. So a few housekeeping rules before we get started, and I pass over to Ala. Attendees, you're on mute. This is to avoid disruption. There will be an opportunity to ask questions at the end of today's webinar. So if any of these do pop up during the webinar, please do leave these through the question panel for us to deal with at the end. The webinar will last for approximately 60 minutes and it will be recorded and will be available to you as a resource on the membership section of the website and also on the Real World Webinar series on our APM YouTube channel. You can always email me if you haven't got the links to these and I'll be happy to provide. So without further ado, I thank you all for joining us today and I thank Ala for his time and I'm pleased to pass over now for the webinar.
Thanks, Lauren. Hello, everyone. First of all, I want to thank the APM institution for offering me this very nice opportunity to share some ideas, some thoughts, and hopefully some insights about the project management in the humanitarian sector. My name is Ala Katab. I'm a civil engineer by background, 15 years of experience in a variety of sectors, mainly in the commercial and the NGO sector, as well as the academic sector. I currently work with Invent Limited in London Holborn as a research and development consultant. I'm also the founder of Bermondsey Welcomes Refugees, which is a nice small charity in Suffolk, London that works to welcome refugee family to the UK. In today's webinar, we're gonna cover the following elements actually, and I hope you're gonna enjoy some nice maybe discussions and insights. We're gonna start with the humanitarian principles and the code of conduct, and this is the ICRC code of conduct. And I thought it's important to start with this just to set the direction of this discussion. Then we're gonna move to the scope quality. We call it also the scope triangle, and we're gonna see how we could apply this in a humanitarian project. The third item will be more about the quality, so more focus will be given to the quality for the humanitarian project, and this is in the technical aspect and also in the overall project management aspect of the humanitarian projects. Then I'm gonna list down maybe 3 or 4 main challenges, and they are sort of first-hand experience challenges when I was helping and doing the humanitarian work in Syria between 2011 and 2016. Of course, I'm gonna cover the impact of each of these challenges on the scope quality. And then finally, I'm gonna maybe finish this with focusing on 2 characteristics of a good humanitarian project management. The characteristics are more than 2 actually, but I decided to focus on the adaptability, which we needed at these maybe strange times of COVID, and also the resilience of the project management from a humanitarian perspective. We're gonna have some Q&A as Lauren mentioned in the beginning. So first of all, the humanitarian principles. And this reminds me actually with the first day of my work with Oxfam in 2014, when I was asked by one of the program advisor to introduce myself. And then I said in proudly manners, I said, I'm the new water projects coordinator. He interrupted me to say, you're first and foremost, you are a humanitarian worker. All of other capacities will go under. In a sense that you start from the principles, and then if you are a technician or a project manager or monitoring officers, you are serving as a humanitarian worker, and that stays with me till now actually. The principles comes first. What are these principles? Humanity, neutrality, impartiality, and independence. If we start with the humanity, humanity means that all of the humanitarian actions, the humanitarian projects should be focusing on reducing the suffering of the people, and aiming to protect the dignity of people, those who are supported by the assistance. Second one is the neutrality. Neutrality, it talks actually on behalf of itself. Neutrality is not taking sides when it comes to delivering the aid. It means that the humanitarian workers and all of the humanitarian actions shouldn't get involved or engage in any hostilities that's based in the political, religious, or racial sort of nature. Impartiality, focusing on the needs and only the needs. So all of the humanitarian actions should be driven by the needs of the people, should prioritize actually the people who are in most need to support, and shouldn't take any consideration to other than the needs. The last one is the independence. Actually, the independence is really easier said than done. Independence means that the organizations, and we're talking about the humanitarian organizations, shouldn't be influenced or shouldn't be driven by the governments, institutions, or other economical factors. They should be autonomous on their actions. I picked actually this picture from the MSF website. MSF is Doctors Without Border. This is very famous organization of being independent in their actions. They, for instance, they are refusing getting any governmental funds or any big institutions funds. They are dependent on generous sort of individual funds. Actually, this is not to suggest that organizations who are getting some governmental or institutional sort of funds, they are not independent, but it's really very tricky maybe area to balance whenever you're delivering the aid. These are the principles. If we go to the Humanitarian Code of Conduct, these 10 rules, actually, they are the ICRC main rules whenever you're delivering a humanitarian project. And I'm not gonna describe each one of them actually, but let's pick two of them. If we say, for instance, we shall attempt to build disaster response on local capacities. If we translate this into project management sort of language, that means the resilience. We will come to this in a further slide actually during this discussion. I highlighted in bold the number 7. So number 7 is ways shall be found to involve programs beneficiaries in the management of relief aid. That means that all of the beneficiaries who are getting the support, they should be involved in the project cycle, and their opinion matters actually. And whenever you design a program or a project, they should be in the heart of it, not as a recipient only of the fund, but also as a people who contribute to the design of the project itself. If we move now more on the project management actually aspects of the humanitarian projects, as you could see, this is the famous scope quality. We call it also the scope triangle. The time, the cost, the quality as well. The time obviously is the time given to achieve this project. The cost is the amount of available resources and the amount of money that you need to spend to achieve your project within the given time. The quality obviously is the fit for purpose that the project is aiming to achieve. In normal cases, or in normal world, in ideal world, I would say, one of these factors will be fixed, and the other two factors will be in sort of inverse proportion to each other's. Like if we take, for instance, the time, assuming that the time is fixed in one of the cases, that means the quality of the project will be really dependent on the amount of resources available. And the same if we say that the quality is fixed. When we say fixed, it means that it's one of the restraints by the clients. So the quality is fixed in this case, and then the cost will be really dependent on the time that is available to implement your project. In a sense that more time you're having to work out, that means less cost. And vice versa. If you spend more time, that means more cost on you. Less time, more cost. More time, less cost. Sorry, I just got it wrong. So that's how they interact with each others. things might go more complex and more interesting if we got two of these factors. And this is the case of most of the humanitarian projects. Specifically, we're talking about two factors, the time and the cost. Time in humanitarian projects would mean saving lives. The cost, on the other hand, means that the more money that you have or the less money that you spend, the more beneficiary that you're serving, and in a sense that the more lives that you're going to save. Let's say these two factors are fixed in a humanitarian context. That means a good project manager should be able to work out solutions around the quality. These solutions around the quality shouldn't touch the core functions of the quality, should be complementary functions, and it's hard to achieve, I should say, in a humanitarian context. In ideal world, you would be able to sacrifice some of the quality elements of your project, but when you're dealing with the humanitarian projects, most of these projects, they are within the minimum standards. So there is very little room, or maybe there is no room to work out around the qualities. And I remember in a lot of occasions when I was doing this work with Oxfam, Midair, and other organizations, that you end up in a situation that you're not able to work solutions around the quality. The fund that you got from the donors is very specific fund. You can't ask for more, and you had to do something with the time. Most of the cases, we go back to the donors, we say, to achieve this project within this cost and this quality, we will be really in need to ask for more time. One of the most actually repeated terms that we used when I was delivering these sort of projects, we used to say no cost extension, the NCE. That was very repeated sort of term in the Syrian context, I mean. The quality is there, but it's still in the minimum standard. It's very debatable sort of topic when it comes to the humanitarian projects, and that's why in this conversation, well, I thought it would be good to focus on this element. The story of the quality of the humanitarian projects is not that old story, actually. For some time ago, the humanitarian bodies, they started to talk about the qualities, and that's back to early 1990s. And there were a lot of discussions about ways that the humanitarian workers would be able to standardize their practices. And again, when we say the quality, we're mentioning the quality in its technical and project management aspect. So there were a lot of efforts around that period of time. And then the Rwanda crisis occurred in 1994. And that was a sad event that killed more than 800,000. Apart from the failure of the international community to prevent this to happen, there was a parallel sort of failure by the humanitarian bodies to respond to the aftermath of the crisis. We ended up actually of 80,000 of died people inside the camps actually, mainly in Congo, just because of the spread of the cholera and other water-prone diseases. That was actually sort of the wake-up call to all of the humanitarian practitioners. And the humanitarian bodies were partly blamed of the death of the 80,000, simply because of the lack of professionalism, the lack of standardization, and most importantly, the lack of the collaborative work that they should consider when they deliver the aid. After this event, actually, they intensified the effort to produce sort of agreed standards that everyone would agree on when it comes to the humanitarian projects. And they produced in 1996, actually, the Sphere Standard. This is the cover of the Sphere Standard. That was trial version in 1996. And then with the Sphere Standard, we were able actually to cover the main areas that we have to focus on whenever it comes to supporting people in emergency context. And I should say they are minimum standards and contextual standards in the same time. So the areas that the Sphere Standard is covering, they are the water supply, sanitation, and hygiene promotion. We call it WASH. Food security and non-food item, nutrition as well, shelter and settlement, health and protection as well. My involvement working in a humanitarian projects were around the WASH. as well as the shelter and the settlements. If we say, for example, the shelter minimum standard to provide for an individual in a very emergency context is 12 square meter per person. And so forth for other, maybe the food elements. There is a specific amount of food you need to provide to any affected people in a crisis. This is one of the examples actually around the water humanitarian standards that I'm more familiar with. This is, for instance, the minimum standard for the water for saving lives, or for water for people in very emergency situations. The amount of the water that need to be provided is between 7.5 and 15 liter per person per day. Of course, the range would vary, depends on the context and the social and cultural norms of the targeted communities. But technically and on paper, the 15 liter per person per day should be minimum enough to save lives. These standards, I should say, and that was one of the main drawbacks around these standards. These standards were written to respond to crisis in a single camp sort of context, not for urban sort of context, and not for middle income countries for sure. And that was one of the main problems that I had to deal with during the years of serving as a humanitarian worker. The standards asking us to provide 15 liter per person per day. When it comes to the Syria crisis, for instance, the minimum amount of liters per person per day, as per the Syria standard, is 15.50 liter per person per day. And that was easily because you're dealing with damaged infrastructure. You're not dealing with a camp situation or a rural situation. Even in the rural cities, in the Syrian context, 90% of the rural areas were equipped with a good infrastructure for water. That was very critical element and very debatable elements that put us in a very hard situation to deal with it actually. And I should say that the way that we went about it is to talk not as an organization, single organization, to talk as a sector and to talk to the donors, just to say some things like these standards simply are not applicable and we need to improve them. The problem is we managed to do this, but was sort of late. The crisis itself started 2011, and then in 2016, the Sphere standard themselves, they issued sort of an urban sort of standards to address these issues. 5 years after the start of the Syria crisis, it wasn't enough, but it wasn't too late as well. I've selected in here, actually, in this slide, other challenges, and these challenges are more specific to the Syrian context. And these are challenges that I had to deal with throughout my journey as a program manager in Oxfam and program manager in MEDE and other local NGOs that I volunteered to support in the Syrian context. The first one is the security and the access challenges. Simply, the security challenges might mean that you have a target area and you have a town or a city, you have your project, you need to implement, and then all of a sudden the war escalated and the conflict heated again in that area, in a sense that you're not able to access and implement your project, and you have to wait until the situation is better. Other access challenges were when you don't have maybe simply an approval to get to that area, and sometimes the approvals might take longer than what you estimated in the first place. Obviously, if we talk about the impact of this challenge on the scope triangle, we're going to see the impact on the time and on the cost. The more time that you're waiting to get accepted to enter or to access, that means the more cost that you're going to pay. And obviously, it's not good for the purpose of saving lives. The way we went about these challenges, actually, specifically the security challenge, we were talking as a sector again, like it's not as Oxfam by itself as an individual organization. We worked as a WASH sector to talk to the authorities and to talk even to the parties, just to have some sort of truce to get an access. In most of the cases, we found ourselves doing convoys that deliver the support as a convoys consisted of not only one organization, like a cluster of organizations who are helping a targeted area. If we go to the second one, which was very actually niche and unique to the Syrian context, that was the lack of the baseline data. And in order to have a very successful project, you need to have benchmark data, or like a baseline data to start with. Otherwise, your project design won't be won't be complete 100% and won't be efficient in the same time. The problem is, in most of the cases, we found ourselves in a situation that you need to support in a specific area, but at the same time, you don't have information about as simple as the number of populations that you're going to support, the water situation inside these areas. It was not easy challenge to deal with, to be honest. The impact of this challenge is on the quality, not only the time. It's going to take some time to do your own context analysis and to collect the data, to do the surveys, and to ask your local partners to give you sort of baseline data to start with. This is clearly a time impact, but the quality was also very hard to achieve, because you need to measure the success of your project based on a baseline data. You don't have it. And to talk to the donor, convincing them that you were successful in delivering this, you don't have like a strong basis to put your argument forward. And I think this is still a challenging factor and outstanding one in a lot of places. And for obvious reasons, the war is there. You don't have like an exact data to design any project based on. Third one is quite interesting actually. Financial challenges, Syrian fluctuation. Well, it's not fluctuation per se. It's devaluation of the Syrian currency. If I, for example, say that in 2010, that just a year before the Syria crisis started, the $1 was equal to 50 Syrian pound. As of today, I believe that $1 is equal to 3,000 Syrian pound. You can imagine the change and the devaluation of the currency itself because of the war situation in the country. I remember one of in 2016 when I was 2015, sorry, when I was working with Oxfam, we just over a night the Syrian pound deteriorated to 3 times to the dollar, and any good project manager, even with all of the risk management measures that you're taking and the mitigation measures that you have them in place, even with these measures, we were not able to anticipate or to expect that just over a night, you're going to get deterioration of the currency 3 times. The impact of this was clearly in the supply chain life cycle. We were not able to attract contractors to implement our projects. All of a sudden, we were out of contractors. They stopped working because obviously by the Syrian law, we need to pay them in the Syrian currency. And the way that we went about this challenge, we sat with the legal departments. We worked as a program and as a logistic department to talk to the authorities and to talk to other actors, international and local actors, to design an appropriate solution to this. We did some interventions and some improvements to the type of contracts that we're dealing with the contractors, for instance, like improving the payment terms, maybe some advance payment to the contractors. Obviously, that was not the practice in the NGO sector. We don't give usually advance payment, but we had to be sort of creative in adding this term to attract contractors to implement these projects. And that was not easy to achieve, and it cost us a lot of time, actually. We used also things that we call it, or a principle that we call it, the power of purchase, in a sense that we used to do like a monthly exercise to see the value of the Syrian pound, or what you can do with the Syrian pound on a monthly basis, and based on that, you pay your contractors and you pay a compensation, or you pay them their invoices. The impact, as I said, was on the time level and in the cost level at the same time. the sad irony, because of this deterioration, we ended up with a lot of savings, which is very good news for a program, for a humanitarian program. I mean, more money, that means that you're going to reach out to more people, but at the same time, you still have, the time is fixed. So you need to design, again, projects and activities to use the savings. Otherwise, the savings, we're going to send them back to the donor, which we try to avoid doing that. So the interaction was very unique specifically for that element. In most of the cases, we managed to design activities and to spend the savings for the good of the people. The last one is the humanitarian standards not applicable, and we've covered this in the previous slides. Obviously, the impact of this was on the quality. The qualities that was approved, for instance, from humanitarian standards perspective, wasn't approved from humanitarian Syrian minimum standards. And as I mentioned in the previous slides, lately the Syria standard, they made improvements to address the urban context crisis. Well, I will move now to two characteristics that I thought it's good to share and to finish maybe the talk with. These are the resilience and the adaptability. Well, they are not the only two good practices or good characteristics that we need to try to implement when we manage humanitarian projects, but I've selected this because they were so relevant to the Syria crisis, and I think they are so relevant to the world that we're living in at the moment. We'll start with the resilience, actually. Resiliency is really crucial to ensure the success of the program itself. That means, from a humanitarian perspective, that you need to address this resilience in a variety of levels. It should go above and below the organizational levels. And when we say above the organizational level, that means the societal level. Obviously, you're implementing your project in a specific context, in a specific environment, and you need to treat this as such when you work out your program. In the project level, actually, the program should address the resilience of the local communities that you are targeting, in a sense that it's not like a one-off exercise that you're doing. You're saving lives, you're doing your projects, but at the same time, you need to ensure that the local capacities are increased as a result of your exercise of your project. And when you hand over your project to the local authorities, you need to make sure that the local authorities or the local partners are able to respond themselves if the crisis hits again. That was purely technical sort of resilience elements within the project. For me, actually, the most important resilience element was on the people side. Your project is implemented by people, and they are the main actually stakeholder to make sure that your project is successful. And you need to ensure that you are building the resilience of these people. And unfortunately, in a lot of cases, you find this element is pretty much overlooked by the top managers. If I bring back this example that we just shared about the supply chain and the deterioration of the currency, we mentioned actually some interventions to make a robust sort of supply chain, more resilient sort of supply chain to keep going with your project. But at the same time, the fluctuation of the currency is affecting the people, the staff of your project. And that was the case when we were doing our projects. We are, as a humanitarian worker, affected by this deterioration. And we had, and I had as a manager at the time, to work out solutions to make sure that they are helped, I mean the staff, for them to be able to help others. And the solution was for this at the time to use the power of purchase itself as a principle to pay the salaries of the staff, and in the sense that you are compensating the staff in case of any deterioration, and that was sort of monthly basis exercise. A lot of examples around the resilience. Some of them, to be honest, bring me back to some emotional moments. It's about the mental health of the staff as well, ensuring that you have full empathy and understanding of of the status of your staff. We were in a war zone actually. We were delivering in Damascus office, was not far or was not away from the consequences of the war. And I remember in one of the occasions I had with the team to sing when we were stuck in a corridor avoiding the mortars. And we ended up all of us singing just to vent out some of the emotions and the stressful feelings, although I didn't like the song at the time, but it was a very good exercise that helped all of us to cope with that situation. It's a very important element, and it shouldn't be overlooked whenever you want to have a successful humanitarian program um, as a good practice. The last slide and the last point I want to highlight is the adaptability. The adaptability means simply that the project itself should be able to respond to any changes in the environment within which the program is operated. What does that mean from a humanitarian perspective? That means you need to deal with any humanitarian changes on the ground. This is the case of security changes on the ground, or currency deterioration, or the conflict just erupted again. All of these situations, you need to deal with them, and you need to be agile enough to respond to them, and to take different approaches if the original approach is not working. Unfortunately, within the Syria crisis context, most of the organizations, they were not able to shift from a small-scale intervention to a large-scale interventions. It took a lot of time until they found like the proper formula to scale up their interventions, but it worked out at the end. That was just simply because most of the humanitarian organizations, they thought that's going to be a very short assignment, and this is what we hoped. Like the crisis hoped that it's not going to take 10 years, but it's 10 years now. But when we started, we hoped that it's going to be like just a passing cloud, and then we ended up doing this for long, and that was one of the reasons these organizations, they were not anticipating the crisis to be a protracted one, and accordingly they took a lot of time until they had their maybe structure agile enough to respond to the needs and to scale up their operations. Well, one of the good examples actually that I would bring in here was one of the examples when I worked with Oxfam GB, that was of Aleppo intervention between 2015 and 2016. And I remember at the time we had only one focal point in the city, and we were sort of building up the structure of the organization inside Aleppo, preparing for a big project to be implemented in the pipeline of our project. That project was rehabilitation of one of the main pumping station, water pumping station in the city, and that was just in the front line of the divided city between the East Aleppo and West Aleppo. And what we had to do at the time, we had to make sure that our focal points and our monitoring officers are there to deliver that project. Talk more on the adaptability actually. All of a sudden the situation in the city escalated to a high extent that we were not able to monitor this ourselves. And one of the alternative approaches that made us adaptable and agile enough to deal with it is just to use local partner as monitoring officers, I would say, to oversee that project. And that was not improvised, sort of spontaneous exercise, because our focal point at the city were building up good relation with all of the local partners and NGOs as well, and to see if we can implement through them. And consequently, we did the training for these guys from the local organization, and we managed to successfully implement that project through the local partner. It wasn't the practice actually at the time, having in mind that we didn't have any MOU sort of agreement with this local organization, but we got very good results at the end of it. We managed to serve more than 1.5 million actually of population across the two sides of the conflict, and because we were adaptable enough to deliver that project. And I thought it's a very good positive example to finish my presentation with. And I hope you found this interesting and informative. But again, we're going to have very soon the Q&A session. But if you have further questions, these are my contact emails. You're more than welcome to carry this conversation throughout these channels. And I think over to you, Lauren.
Yes, thank you, Ella. That's really insightful and yeah, quite mind-blowing in consideration for the challenges that you come across being involved in the war. So yeah, that really took me back when you said about having to sing to try and distract and keep your staff members and your team in a good place. So we do have a question, and it's from Emmanuel, and he said most humanitarian project engineer solutions to mitigate external issues. How can lessons learned on a project in a particular region be adapted elsewhere?
Well, that's $1 million questions. That's when it comes to like a very new crisis like the Syrian one. But I should say it wasn't the first crisis in a middle income country that you can take the lesson from. If we go back to the Bosnia sort of crisis, the humanitarian bodies started to learn, but the problem is it started from the Rwanda crisis that was like time ago after other crises happened. But I should say in the positive side, the humanitarian knowledge is being built day by day. Like if we look at the standard, the sphere standard, I think every 2 years they issue new standards that they put the best practices in these standards. And we've got a lot of platforms, humanitarian platforms, that all of the practitioners are sharing their knowledge. And good point about the humanitarian bodies. The knowledge sharing is not something that it's exclusive to one organization or another. It's the case that everyone is willing to share. One of the stories that or examples that I remember from the Syria crisis, I had once a meeting with the ICRC, and I was representing Oxfam, and I was joined by one of the volunteers. And after that meeting, the volunteer asked me one direct question: Ala, you shared everything with our counterpart and in that target area, but this is our pipeline of projects. And I told her, well, if they are able to implement that project faster than us, I would go for that. I would be more than happy. Our impetus is a humanitarian. So this is a good point about the humanitarian bodies willing to share knowledge, which does not exist, unfortunately, in a lot of other sectors.
That's great question. Thank you. A question from me, actually. Obviously, this is a new webinar for me. This is the first one that I've done in this sort of situation. Obviously, when you come up with conflict, like you do in many projects, how would you resolve that when you're in a heightened situation, as such as yours when you were in Syria?
You mean, Lauren, the conflict as surrounding conflict or internal conflict between the staffs, for instance, or like organizational?
That's it, between the staffs within the project.
Well, this was sort of day-to-day exercise because of the day-to-day rapid changes that you have to deal with. You've got different opinions. But I kept reminding everyone I had maybe conflict with, let's go back to the principles. Would this serve the people faster? Would this be more sustainable in a sense that we're going to avoid another crisis? So we go back to the basics: 4 principles: neutrality, independence, impartiality, and humanity. And all of the discussions and the conflict resolutions will be using these principles as a base to solve this situation. And we ended up, in most of the cases, finding a middle ground solution that satisfies all of the parties inside the organization. But I should say it's not easy exercise to do, and it wasn't always successful.
No, but I think that's a good point, and it can work in any project, is to take it back to the core principles of what and why. That's definitely a good key takeaway. I'm going to leave the floor open for any more questions that come through. So please do pop these through the question panel whilst we've got Alar here. We've got until 1:30 if any more questions are here. We've got David Shepherd. He said, is it difficult to manage and liaise with stakeholders in humanitarian situations where communication may be quite difficult?
That's right. It's extremely difficult. And before I answer this question, one of the very good lessons that any other sector would be able to take from this sector is the remote working, since we're talking about the difficulty of the communication. Yes, in different levels, the dealing with stakeholders was hard. If I take the local level, it wasn't easy to reach some areas to talk, to get the proper picture. But at the same time, we managed to get most of our staff in the local areas. They are local people. That would make the mission easier. But the hardest part for me, and that was my experience with dealing with international donors in the country, was they don't have the full picture. And most of the donors talking about DFID, or what's so-called DFID, and ECHO and other donors, they didn't wish to come to the country and to see their eyes for all of the political and other maybe there are other reasons. That made it very hard to convince them. And if I take back this example of the 15 liter per person per day, it took a lot of time to convince the donors that this is not applicable. You don't get us accountable to standards that we are not able to apply them. But I think the more the crisis prolonged, unfortunately, the more the donors realized the complexity of this context, and they were more understanding of our point of view when it comes to these problems. But it was hard in the all levels.
That's great, thank you, Ala. We've got a question here from Brendan. Have you experienced the power of principles in non-humanitarian projects? If not, and why do you think this is?
Well, would you please say it again, Lauren? I missed the first part.
No problem. Have you experienced the power of principles in non-humanitarian projects? If not, why do you think this is?
Well, I think the principles are the things that drive anyone to do whatever they want to do. Like when we're talking humanitarian, I was driven by my values and my principles of helping people, my people. When it comes to doing other businesses, like I currently work with Invent Limited, our purpose is just to help our customers and to make a better construction practices, and that's what drove me to be with this business. So it needs to be always in the back of the head of anyone who wants to do any other job. It's more stressful and more, I would say more difficult to apply when it comes to work with the humanitarian context, because you found yourself, sometimes talking to people that you don't share the same values with, but at the same time you need to deliver the assistance, and you need just to turn an eye on that element, actually, just to be able to help people. It's more difficult. While in other sectors, if you don't want to work with that, like for instance, greedy partner, you don't sign a contract with them. It wasn't the case in the humanitarian world. Principles are there in every single maybe job that I used to do before, and my current job as well.
That's great, thank you, Ala. No more questions popping up at the moment. I can hear a bit of feedback when I speak. I'll try and fix that. Got a question here from Tracy. Do you have any advice on finding a local on-the-ground organisation to work with, and how do you help develop the relationship?
Well, I think if Tracy is talking about on the ground in the UK or in Syria, she means. I will answer both, actually. I currently work as a volunteer in Bermondsey Welcomes Refugees, which is an organization I found 2 years ago, and our aim is really to welcome a refugee family from the context of the Syria crisis, probably from the camps in Jordan or in Lebanon. So I would encourage people to consider maybe donating to us, or even to get involved in other aspects, since we're expecting the family to come to Suffolk in a month or 2 months' time. So this is a good place maybe to work with, or to consider to donate or to work with. On the ground in Syria, I'm not pretty much involved at the moment in doing humanitarian work inside Syria. But we might take this offline with Tracy if she wants.
Tracy's just clarified she meant in country.
Well, yeah, inside Syria, I'm not familiar now what is exactly the situation. because of the physical distance. A lot of great work is being implemented on the ground, especially with the economical hard situation that's in the city. But I'm happy to take maybe this conversation offline, so I can maybe nominate some organization to consider to work with.
That's great. Thank you. And we have a question here from Nicola. She said, how did they measure project success deliverables?
Well, in the technical aspect of the measurement, there was specific indicators that we need to adhere to, and that's it's purely in the hard side of it. Like if we say that we need to support in a shelter for a 1,000 beneficiary or displaced person, so you need to secure the amount of meters that's written in the standards, and that's how we design the project. But when it comes to dealing with the logical frameworks that we dealt with, for instance, the DFID logical framework, there is a certain indicators like we're talking, for instance, about 3 water establishments or 3 water facilities that you repaired. So you need to ensure by the end of the 2 years agreement that you manage to deliver the support to 3 water facilities, and that's how we were measuring the indicators. So in the technical aspect of it, it's purely sort of, for me, was engineering practice, ticking the boxes, but you need to consider the the context that you're talking about. In the high level, in the organizational level, it's a logical framework, number of beneficiaries you need to meet as a target, and number of water establishments that you did train their staff, or number of water pumping station you rehabilitated. All of that, they are the indicators, but I should say some of the good indicators that they were added to the sphere standard, they were the community meetings indicators, and that was something that I was advocating for in 2016. And my research that I did for my master's degree was about improving the humanitarian standards, and I was glad to see some of the ideas inspired my research, talking about the engagement of the community. So the standard asking for specific meetings or number of meetings with the community as an indicator to measure your success. If you didn't ask or consult the community of your intervention, your project is not successful. And that was like a written number standard. So that was good practice.
This is a follow-on question from Nicola. Is it difficult in these situations, or were you still able to celebrate the success?
Success is a success. It's going to be more rewarding if it was success that reached, for instance, 1 million people in Aleppo city. Like I remember every water drop that we were delivering inside the country, working with Oxfam and Midday, we were celebrating like kids. It's the test is different when you hear that the water is being pumped like in a divided city to reach out to the people who are waiting for months. Technically, Aleppo city was suffering for 6 months of no water because of the electricity cutoff. And because of the generator that we installed in that city, we managed to give some few hours a day for them just to fill in their tanks. So yeah, we were almost in tears hearing the good news in each city that we were intervening in.
That's great, thank you. Brendan has said, is there enough coordination between humanitarian organisations to ensure the power of donations received is not diluted, and that there is a pursuit of donations is sufficiently focused?
Yes, there was sort of formula, and again, my experience is just within the Syrian context. There was sort of formula of 3 offices in Damascus, Amman, and Gaziantep. They are the 3 hubs to manage the Syria crisis. So they were coordinated together, and the UN OCHA was the one on the top of these 3 hubs to coordinate all of the effort in a way that you're not duplicating your effort when you're delivering the aid, and you're ensuring an effective implementation of your program. That was in the higher level, in the cluster level. We used to work. I used to work as within the cluster of the water, for instance, in Syria, representing Oxfam and other organizations. And this sector is consisting of like, I think 10 or more than 10 local and international organizations when it comes to big fund, for instance, coming from the UN or from DFID, the DFID will talk to this sector at first before they doing maybe the deals with other organizations in a way that they are ensuring that the fund will be delivered in a fair manner to these organizations at the same time, not duplicating the effort on the ground, in a sense that you're going to reach to more people as a consequence.
That's great. Thank you, Ella. No questions at the moment. We'll wait for some more to come through. So I'll take the opportunity to ask another question for myself. Obviously, I view project management as a very transferable skill, the methodologies that we can adapt from one sector to another. What advice would you give to someone, say, from the construction sector that wants to get involved in the not-for-profit or charity or humanitarian sector? What would they need to do to be able to cross over from one to another? What differences do you see that there are?
It's so important actually to focus on the potential and to strengthen these potentials and to cross these circles. Like if you are in a circle of construction work, you might have the skill of, let's say, the communication skills of being empathetic to deal with your colleagues at work. That's a good start to move or to consider if you want to volunteer in the NGO sectors to add value, to practice this skill that you have in the other sector. Most of the soft skills are transferable between these two sectors, but the humanitarian sector, for instance, is in most in need to the technical skills at the same time. Like you rarely found doctors who are willing maybe to volunteer or to work even with the humanitarian sector. So the technical skills are really needed in that sector. But again, back to the questions, I think anyone in construction sector, for instance, or any other sector, business sector, need to focus on the potential that they might have in the charity sector, which would be mainly around the soft skills. I mentioned the empathy, but there are other maybe characteristics that you can practice them outside of the construction world. Like currently I'm working in the construction sector, but I'm using all of my management skills to work with Bermondsey welcomes refugees at the same time to help in welcoming refugee family, and these technical skills are being used here and there. So nothing would stop me to be an active voluntarily or even in work capacity.
That's amazing, thank you. We've had no other questions come through at the moment, so I assume we've dealt with everything, Hala. You very kindly have left your email address up on the screen, so please do be in touch offline if you want to ask Hala any more questions. But I'll just finish up with a big thank you from me, not only for the work you do, but also for the webinar and knowledge share itself. It was really insightful.
Well, just thank you to the APM to give me this opportunity to share these ideas. And the audience of the ABM, I think most of the audience would be maybe interested in the business and other professional world. The humanitarian sector is professional sector as well. And I hope to see more representation of this sector in your organization. And thank you very much.